Hello everyone, welcome to our show Wellness Time. I'm Dr. Deepti and today we have with us on our show our esteemed guest Dr. Baban Doras, who is an ophthalmic surgeon. Hello Dr. Doras.
Hello.
I just wanted to ask you a few things regarding eye care, and my first question would be, is ophthalmology a separately studied science in modern medicine?
See, my basic qualification is MBBS. So after graduation, there are many specialties. So ophthalmology is one of that. So though eye is a very small organ, so it's a very vast science is there. So you can see there is a surgery, orthopedics, then gynecology, medicine. So like that, ophthalmology is a separate branch in modern medicine. But nowadays, it's a era of super specialty. So in ophthalmology also, now there are super specialties. Like in ophthalmology, there is cornea specialist, there is retina specialist, there is oculoplastic surgeon, there is a pediatric ophthalmology. So like that, there are different specialties also
Right.
there. Yeah.
Okay. So, if you have eye problems or
Okay.
issues, how do you choose which doctor to go to?
There is a term called as general ophthalmologist or comprehensive ophthalmologist.
Okay.
So basically, if you have any eye problem, so nowadays the common eye problem is refractive errors.
Right.
The kids come, they say, we won't be able to see on the blackboard and all that. No? So in such cases, your patients go to the optometrist also. You can say optical shops. They go there, they check their eyes. If eyesight is normal, that's fine. If eyesight is not normal, then they give spectacles to the kids. But some cases, even if spectacles are given, the eyesight is not improved. So in such cases, so ideally, if you have eye problem, so you should go to the nearby ophthalmologist only.
Rather than going to
rather
a
than going to the
spectacular
spectacles. And you can go to the general family physician also. So they also can see. And most of the patients, they are referred to us by family physician
Right.
only. So if they consider there is some problem related to eyes, then they refer patients to us.
So they don't walk into your
Yeah,
clinics
they
directly.
do. But
Mostly.
in India, so it's like a family physicians.
You have a
So,
concept
yeah,
of family
they have a
physician,
concept of
trusted doctor since ages. I think since. Okay. What are the current challenges that people are facing about eye health in modern medicine? Can you give us an insight on that?
See, actually, as I said, ophthalmology is a vast branch. So, current challenges, there are many challenges, right? You can start from the cornea, which is the basic layer of eye, up to the retina. And before that also, there is a tail film layer. So, current challenges, so you can see because of the more screen time.
Right.
So, in COVID area, the eye problems suddenly increase.
Work from home.
You work from home, and also the kids, they
No
for them
schools,
also,
nothing.
no schools, nothing, but online classes were there. So they were more used to the mobile than laptop and all like that. No? So current challenge you can see because of the pollution also. So there are many patients of dry eyes.
Okay.
And the patient and the people who work in IT, so they have computer vision syndrome.
Right.
So what is computer vision syndrome? It's like a dry eye only. So if you are exposed
Too much
to the
screen.
exposed to the screen, so your tear film layer get disturbed. So normally you should blink at least 10 to 15 times in a minute.
Oh, so that's an exercise.
Yeah, no, that's not an exercise. That's a routine actually. So
I mean,
people
you are suggesting that
people
exercise.
forget to do blinking because there is a staring look. So, and because of that, tear film layers get disturbed, and people and you expose to the dry eyes. So that is the main challenge. And another challenge you can see trauma. The kids play outside in India because of firecracker injuries and all, Diwali and all. No? So many, even farmers work in the field, so they are more prone to trauma.
Okay.
So these are the challenges.
So these are the common symptoms
Yes,
with which
yes.
patients come to you.
And
I think
other
nowadays children also have a lot of tendency for refractive errors. I mean, I have seen small children who have large spectacles and numbers.
More exposure to screen and this.
Okay.
So otherwise also actually there are problems of refractive error, and if you don't come to the doctors for a long period, and suddenly maybe after few years parents come and he is not seeing properly. So in that case there is a term called as amblyopia or lazy eye.
Okay.
So if you have refractive error and you don't use specs for more time, so then your eyes become dormant, you can say, no? And you get a problem called as laziness. So if lazy eye is there, even if eyes are normal anatomically, still you are not able to see. So there is no treatment for that. Earlier the diagnosis it's better.
But do the children complain or how?
Children don't complain. It's actually once children comes to us and we examine, then that is after examination.
So the parents also don't understand there is a problem with the child, and the child also is not complaining.
Exactly. Most of the times what happens, there is a problem in one eye only. So if other eye is normal, so we don't see closing one eye, no?
Okay.
So most of the times, if problem is one eye, that is diagnosed after coming to the doctors only.
Okay. What are the effects of complications of chronic diseases on the eye? Like certain, like diabetes and hypertension, so many things accompanied. What are the complications you can see if it is not treated for a longer time, or you're taking medications for a longer time?
Okay, so actually, as you know, the diabetes is the current challenge.
Right.
Actually, you can say it's India might be a capital of diabetic patients in the coming future. So diabetes actually, if it is not controlled, so then there are many problems related to eye. So like diabetic retinopathy. So retina is affected. You get minor like hemorrhages in the eye. Then even you can get cataract also. You can get vitreous hemorrhage also. You can get. So for diabetic patients, we recommend.
Is glaucoma associated with diabetes?
Glaucoma not directly, but maybe because of vascularization, neovascularization. Na? So diabetic patients are more prone to neovascular glaucoma. Right. So mainly actually. Main thing is that your diabetes should be controlled, and another actually longer the period of diabetes, the more the complications.
So
for diabetic patients, we recommend that every 6 months at least they should have regular eye checkup. So for that also there is a prevention is there. So we do laser treatment like pan-retinal photocoagulation to prevent the hemorrhage and all. So that once you do that, so your eyes are less prone for the complications.
But I think it's better that before the optic nerve is damaged, then it is irreparable.
Actually, optic nerve is directly not related to the diabetes. But if, as you said, if glaucoma is there, so because of excessive pressure and all, so the optic nerve gets involved. But it's rare in diabetes.
So I think every diabetic should have an eye checkup. I should say I think every 3 months.
At least every 6 months. If your diabetes is controlled, then at least every 6 months. If it is not controlled, maybe monthly also.
But many a times you see that people go unrecognized. I mean, if there is heredity in the house, then only they feel that we should get it checked.
Exactly. But many times actually people come to us for different problems, like for cataract surgery.
Then
for cataract surgery, we advise them routine investigations. And suddenly they come to know that I have a diabetes. Like that. So routine checkup is also necessary.
Important.
Yeah.
In modern medicine, is nutrition a part of eye care? Does diet help in the eyes?
Yeah, definitely. You see in children also, because of vitamin A deficiency, children might become blind also.
Right.
So vitamin A is for them actually, I think that is the national program also. Vitamin A supplements and all.
Government hospital, we have the doses for vitamin
A. We recommend that everyone actually, not only children, but everyone should have salad like carrot, cucumber in their diet, then all fruits, green leafy vegetables, eggs. So all that is actually necessary actually. So it's not like that your diabetes diet is proper, so you can't have any eye problems, but chances will be less.
So it's better that you have a proper diet to avoid all these things.
Yes. Prevention. Yeah.
Okay.
But it's not guaranteed, but at least the chances will be less
Okay.
to have eye problems.
I would also like to ask you now, there are so many myths regarding conjunctivitis. As the season changes, you see a lot of patients
Okay.
who come up with conjunctivitis, red eye,
Okay.
there is itching in the eyes and all. But then somebody will say, don't look into my eyes. That's a common this thing I have seen. Then I'll catch infection.
Okay, yeah.
Something like this, so many things associated with conjunctivitis. Can you give us a insight into what is conjunctivitis and how a common person can, take care of their eyes during conjunctivitis before going to an ophthalmologist or consulting a doctor? Means at home, can we take care of the eyes?
Definitely. Actually, conjunctivitis, again, there are different types of conjunctivitis. Allergic conjunctivitis, which is very common in children.
Right.
Then infective, whatever you what you were
Infective,
talking,
yeah.
that is infective conjunctivitis. Infective, again, there is bacterial conjunctivitis, fungal conjunctivitis, viral conjunctivitis, like that. Na? The most common is during epidemic, it's a infective conjunctivitis. So that can spread if you touch your eyes. Even if you have conjunctivitis for one eye, so it can happen to the other eye also. So you should take precautions. We ask patient to use goggle because most of the time it is airborne also.
Right.
So that's why it is said that don't look into my eyes and all.
Do we catch conjunctivitis if we look into somebody's eyes who has conjunctivitis,
we can
with the
actually.
contact?
Most of the doctors like me also get conjunctivitis because we examine patients frequently, So if it is airborne, so
depending upon what type of conjunctivitis it is. Okay.
So that's why actually we ask patient to use goggle, maintain hygiene. So don't touch here and there like that. So don't use whatever towel or something.
Somebody don't share it.
Don't share with that. And frequently wash your eyes with warm water and like that. And usually we give antibiotic drops. So it is very severe. Then even your cornea might get involved actually. So that regular treatment is important. And most of the times, what family physicians do, they prescribe steroids.
Right.
But steroids are it gives you temporary relief actually, but
the cause is not being taken care of.
Long term, so
you just suppress the cause.
You just suppress the inflammation, but infective part remains like that.
Right, and it will cause more. It will flare the
So actually,
condition.
my advice to general practitioners or family physicians also on this diet, you don't use steroids actually unless and until your eye specialist prescribes. Then only. Even if you use steroids, that should be under antibiotic cover.
Okay, so I think only antibiotic cover. If at all you're going to a general physician, you need to have antibiotics.
Once the infection is controlled and some inflammation is there, then in that case only we use steroids.
Otherwise not. Okay, so in the children also you will prefer to give them antibiotics, eye drops?
Yeah.
Okay. There's one more question I would like to ask you, doctor. Nowadays, most of the people don't want to wear spectacles for so many reasons. So, can you suggest anything for a spectacle-free lifestyle for them?
Yeah. Actually, currently there are many options. If you don't want to use spectacles, you can use contact lens first thing. But contact lens is again just a replacement for the spectacles. You need to use it for a day, and at night you need to remove it. But again, if you are 40 plus, so then you can't use spectacle for near vision. Only for distance vision you need to use the spectacle. But recently you can do LASIK surgery or refractive surgery for removing your spectacles. Yeah. So ideally you can't do it in children, but if your age is 18 plus, in those cases you can do refractive surgery. The criteria is actually first thing that your age should be more than 18 years. Then second, your number should be constant at least for 6 months. Then you can go for refractive surgery. And again, depending on your number, there are different procedures actually. You can say the LASIK also, there is femto-LASIK is there, the SMILE is there, then Contura is there. There are different procedures are there. But basic LASIK, before going for basic LASIK, you need to do some investigations. Like your corneal topography, you need to do pachymetry. If your corneal thickness is more, then only you can go for LASIK surgery. If it is less and your number is more, Then there is the option of implantable contact lens also.
Okay.
Like whatever you use contact lens outside the cornea, so
You
that
put
you
it
need to
inside.
like after cataract surgery replacement of the lens, like that only implantable contact lens can be implanted inside the eye, so that can be removed anytime.
Okay.
So in future if you have cataract and all, so that lens is replaced with the intraocular lens. So, and actually if your number is more, if very much, so you can do clear lens extraction also. A clear lens extraction and put a lens of proper power.
So how effective is it? I mean, is it lifelong,
It's
or you need
lifelong.
to keep on changing? I mean, you need to have checkups routine so that you understand whether the number is like, do we use spectacles? That time we have a checkup, right? To see whether the number is same or is it increased.
No,
So-
most of the times it is permanent only.
Okay.
So that's why actually I said the main criteria is your age should be 18 plus, and whatever your number is there now, it should be constant at least for 6 months.
Oh, okay.
If it is increasing, then don't go for it. It's better to
Avoid.
wait. Better to wait actually. Wait till your number becomes constant. Then only you can go for refractive surgery.
Okay.
Yeah.
My next question would be regarding cataract.
Okay.
Can you tell me what is cataract, and is it curable, or do you require surgery?
Yeah, cataract is what actually in your eyes, normal eyes, there is a lens. So that lens is transparent. Once that transparent lens becomes opaque, that is called as cataract.
Okay.
So cataract actually literal meaning is cloudiness of the
Haziness.
lens. Yeah. Actually for cataract, unfortunately there is no medical line of treatment, and there is no alternative to surgery. So if cataract is diagnosed, you have to undergo surgery only. But nowadays, because of this in modern era, because of research and all, so cataract surgery is become very easy. So there are different options. The main thing is that it is painless surgery. So no need to give any injection also. Without injection, without
No anesthesia is
no.
required?
Topical anesthesia we
Okay.
use. Only drops are used.
Mm-hmm.
And it's a daycare surgery. Means
Oh, so you
can
it's
go,
an outpatient surgery.
Yes. But actually in intraocular lens there are different types. So many times patient gets confused which lens to put. So apart from Indian and imported lenses, there is a monovision lenses and multifocal lenses.
Okay.
Multifocal, trifocal lenses. If you don't want spectacle for near also, then you can go for multifocal or trifocal lenses. But most of the times in that case also patient have problem like halos in the night, glare and all. So we recommend such patients to undergo surgery with monofocal lens only. So nowadays there are lenses called as extended depth focus also. We call it as a EDOF lens. So those are the better lenses. You require spectacle for near vision, but number is very less actually. But you have vision like a natural lens only. So the depth focus and all, it's very good in those cases.
I would also like to know, is there a time frame? Like when you detect or there is a diagnosis that you have cataract, and do you have to go in for a surgery immediately, or you can wait, or means what is the time slag?
It's a very good question actually. So previously, people used to come to doctor when the cataract becomes very mature or hyper mature. So in those cases only surgery. But nowadays, actually because of your day-to-day work, it depends actually. It's not an emergency procedure, but you have problem with your day-to-day activities for your working and all.
Your vision is also decreased.
Yes. You can undergo surgery anytime. Even if the cataract is 1%, you can go for
so
surgery.
you don't have to wait like before. They used to say let it mature and then you go in for a surgery. No.
Earlier the better, because the quality of life, quality of vision becomes better actually.
Okay.
So we give choice to patients only. So we tell them frankly that it's not an emergency. If you want to wait, you can wait.
Okay. So they have a choice.
Yeah. But in certain cases there is an emergency. If the cataract is hyper mature, if cataract becomes hyper mature, there are chances of developing glaucoma.
Okay.
Then in case of traumatic cataract, Even in case of congenital cataract or in children also, if we detect cataract, so those cases there are chances of laziness or amblyopia.
Okay.
So if they don't use their eyes, then eyes ultimately become lazy.
Right.
So in those cases, you can consider it as an emergency surgery.
Okay.
Or earlier the better. Yeah.
Okay, good. I also know that you run a foundation, Nitya Seva.
It's a Global
Vision Foundation for eye donation.
Yeah.
So can you tell us more about it?
Yeah, actually, in India, from 25th August to 8th of September, every year, eye donation fortnight is observed.
Okay.
So this is, I think, 39th year. So actually, I started eye bank in Pimpri-Chinchwad area in 2008. So that was the first eye bank in Pimpri-Chinchwad area. The main purpose is that actually people should be aware. So you see, actually, in Buddhism, so there is importance for donation.
Okay.
Or dana.
Mm-hmm.
So in Sri Lanka, most of the people do eye donations. So this country actually exports the corneas or eyes. So only thing means the main reason is that, so there actually if you don't want to donate, you need to tell.
Oh.
After my death, I don't want to donate my eyes. Otherwise,
otherwise
automatically it is there.
So everyone has to go in for a eye donation in Sri Lanka. It's compulsory.
Not compulsory. It's by default actually.
Okay. It's in the system.
It's in the system only. If you don't want to go, and in European countries or in Western countries, if accidental death is there, then by default the eye donation is done. But India actually.
There is no awareness.
Very less actually. You see the most of the deaths occur in India only. Eye donation is very less actually. So that's why actually this fortnight is observed. Eye donation awareness fortnight. There are many people actually who are blind because of cornea, corneal opacification and all. Na? So for such cases only this eye donation is important. So this actually we undergo many activities. The next Sunday also we have one cycle rally for awareness of eye donation, and then in Ganesh festival, Navratri also we give lectures
on eye
donation. On eye donation, so, awareness of eye donation.
How many eye donations have happened in your foundation till now? I mean, do people go in voluntarily for eye donation or how?
No. Actually,
and then the relatives. Means I just want to ask, even if I want to go in for an eye donation, after I'm gone, my relatives, if they don't, they are not willing for it to happen, then you can go in for the eye donation.
Even if you are willing to do eye donation after your death, if your relatives, your next to kin,
right,
they are not willing, then we can't.
You can't force.
Okay. So that's why actually nowadays instead of filling the form, so we ask them to take a pledge. So mass pledge we take. After my death, so we'll promote our relatives, promote our next to kin to go for eye donations. In India, actually, there is a post called as grief counselor. So most of the times after death, so the relatives or people, they are not in a position to listen to you, na? So there are posts like the grief counselor. They are trained for this. In ICU and all, na? So most of the deaths occur in hospital.
But I think there is a period. There is a period after your death. Means how long you can.
Earlier the better. But ideally within 6 hours.
6 hours.
If you
so
remove
before that,
cornea,
they should do the counseling and all, and so that.
After that also, it's not like that. It's more than 6 hours and we can't do eye donation. You can do. But earlier the better because the quality of tissue is better.
I think eye donation is the best dana one can offer to the people, who need it. And then I think you live after you're gone with your eyes, so that someone else can see through your eyes.
So that's how we have different slogans actually.
Okay, so I think we have come to the end of our show. And thank you, Dr. Doris, for giving us such important information regarding eye care. And thank you for coming to our show.
Thank you for inviting.